Courtney, documenting on the 26-year-old patient named Brittany. Patient was awake, alert, and oriented times 3 with no recent weight gain or loss. Posture was erect, gait was steady, no physical deformities. Patient was well groomed, speech was clear, she spoke English. Skin was warm and dry to touch, with pink undertones. Skin turtle was resilient. Radial and brachial pulses were strong and equal bilaterally. In regards to the patient head and face, she demonstrated cranial nerve 7. Temporal arteries were non-tender. Also, cranial nerve 5 was demonstrated. As far as her neck goes, there were no masses or tenderness. No lymph nodes were non-palpable. Her carotid arteries were 2+ bilaterally with no bruits noted. Full range of motion. She also demonstrated cranial nerve 11. In regards to her eyes, I believe she demonstrated cranial nerve 3, 4, and 6. No redness or discharge. Her conjunctiva was moist, sclera white, no lesions, redness. Cornea was moist. Also, according to her eye, she demonstrated cranial nerve 8. Nose, cranial nerve 1 was demonstrated. Nares were patent bilaterally. Mucous membranes were moist with no purulent drainage. Also, her lips and buccal mucosa was pink and moist with 32 white teeth present. Her gums were pink with no redness or swelling. Also, her hard and soft palate was smooth and pink, I believe. Yes, it was. Her tonsils were non-inflamed. She also demonstrated cranial nerve 9 and 10, and her thyroid gland was non-palpable with no tenderness. In regards to her thorax and her lungs, her scapula and thorax were even bilaterally with no use of accessory muscles noted. Resonance sound heard posteriorly. Non-tender, skin warm and moist to touch with no lumps or masses noted. Also, she had vestibular breath sounds. As far as her heart, S1, S2 noted, apical pulse were palpated in the 5th intercostal space at the left mid-clavicle line. Also, S1 and S2 were heard over the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral areas. As far as her abdomen, it was round with no scars, lesions or rashes. Umbilicus was midline. She had an active bowel signs present in all 4 quadrants. Tympani, overall 4 quadrants with no tenderness or pain. And as far as her lower extremities, they were symmetrical with no lesions, nodules, deformities, or swelling. No redness. Hair was distributed evenly. All pulses were strong and equal bilaterally with a full range of motion, including her upper extremities had a full range of motion. As far as her neurological status, she had a negative Romberg's test with the patellar reflexes scoring at 2+ bilaterally. And as far as her musculoskeletal test for scoliosis, she had no abnormal lateral curvature to the spine noted. And this completes the documentation of my assessment.